Good evening, everyone. Gordon Causey, live and unscripted at 11:55 on Saturday, the 17th of December, 2022. Hopefully, the dog will be calm. Got her treat. Come here. There's Candy, the Wonder Pup. Yeah, you good girl. There you go. That should placate her for a bit. I see I have one person watching. Thank you for jumping on. Saturday, I worked again today from 9 to 3. Hey, 986D, a very happy Merry Christmas to you as well, my friend. And again, thank you for saying hi. I love the engagement. I wanted to talk about a few of the things that happened in my home province of Ontario. I don't know if 986D is from Ontario, Canada, but some quick context. Ontario is Canada's largest province. We're nearly 15 million people, I think 14.8 million people. So this jurisdiction, this province, has a population better than the entire population of Sweden, better than the population of Belgium. I don't know what the population of Ireland is, but I'll throw in my Irish accent, a bit of my Irish brogue for you. I see that 986 has typed that he's from Dublin, Ireland, and I'm not even sure. I don't know if my accent's Belfast or closer to Dublin. I'm not sure. But if you go back in my family DNA, we were O'Malley's on my mother's side of the family. I'll drop the Irish accent because I can't keep it going for too long. Oh, not too bad. About 5.5 million here, I think, is what he says about Ireland. Anyway, what happened in Ontario, which is where Canada's largest city, Toronto, is located. In Ontario, in this past week, just in the last day or so, it was either on Friday or Thursday, our chief medical officer of health is a gentleman by the name of Dr. Keiran Moore. And he weighed in on masking. And there are a lot of people in Ontario. We have this Dr. Mirth, who's a family doctor, has a medical practice in Ottawa, Ontario. And she's been a public figure, got herself elected to the Ottawa School Board, tried to institute a mask mandate that thankfully failed in that jurisdiction. She wanted to force masks onto children and anyone in an Ottawa area school. And that motion was defeated in a vote that was 6-6. For the motion to carry, it would have required a simple majority of 7 out of 12 votes. They didn't get it. They only got 6. And a tie goes to defeating the motion. Well, Dr. Keiran Moore weighed in. And he said that there are no plans to bring back a mask mandate anytime in the immediate foreseeable future. And he talked about the issue of something called immunity debt. And what he's contending is that he believes, he doesn't say he proves it, but he believes that the lockdown, masking efforts, keeping people away from viruses, pathogens, bacteria, and germs, that in terms of our kids, that it has weakened their innate, natural, I will say God-given immune systems. And so that now that they're out in school and everything, now their weakened immune systems are unable to combat things like this RSV, respiratory syncytial virus. And 986D is writing, I fear it's coming back here soon as well. The hospitals are overrun with flu and scarlet fever. It's worse now than it ever was with COVID. And that's the Same thing here. There are all kinds of panicky style news reporting about hospitals having to triage patients and prioritize who gets vital surgeries, of children being airlifted to hospitals hundreds of kilometers away because there's no room in their more local hospital. There was one I read, and I forget exactly the jurisdiction, but the closest one to them, it would have been, they ended up having to be airlifted to Kingston, which is some 400 kilometers away from where the child lives. And so so some individuals like this Dr. Mirth in Ottawa are screaming, we have to bring back masks. And Dr. Keiran Moore has said that he is of the opinion that masking has weakened the immune systems of our children and is leading to increased incidences of RSV and influenzas. I haven't heard about scarlet fever here. The one I'm hearing about now is streptococcus, strep, and that it's also on the rise. So good news. One of the things, though, that I would love to see done is for hospitals to conduct a study of some description and to ask parents, what is the masking behavior of the children who are falling seriously ill with, be it COVID, RSV, influenza, strep, whatever it is. And are they wearing a mask for 3, 4, 5, 6 hours a day? In Ontario, schools with some variants, the gray in my beard notwithstanding, my youngest child is in grade 4. And he starts school at 8:15 and it goes until 2:35. So you're looking at in and around a 6-hour day, and children sucking air through a dirty piece of cloth for 6, or even if it's a medical mask, sucking air through those things for 4, 5, 6 hours a day. Intuitively, it does not strike me, non-expert, not offering medical advice, it strikes me as unhealthy. But what do I know? And you bring up 986D brings up the second point that I'd love to know, the jab status of the children in hospital. There was an earlier study that was quoted by a Dr. Patrick Provost, who's a microbiologist, professor, researcher out of the Université de Laval University in Quebec City. And he cited a study that was done that was showing that the jabbed are 4 times more likely to end up in hospital with RSV specifically as compared to those who are unjabbed. Now, critics of that study said that it only represented a couple dozen, 2 or 3 dozen, somewhere around 30 cases, and that the power, that the numbers are too low. The total number of individuals looked at, it's too low a number to have any statistical significance. And that's fair enough, in the scientific world and medical research. Statistical significance requires that you have a decently large population study, and 2, 3 dozen doesn't add up. However, now there are hundreds, probably 1,000 plus kids in Ontario hospitals. There are plenty now, and there'd be a much larger indication. But of course, do we hear anything about this? I am of the non-expert opinion that anything that would show the jabs in a negative light is not investigated. If there's the potential for it to increase levels of hesitancy among the population, well, we're not doing that study. That's just an editorial opinion. Wanted to cover another little bit of news that came out and dropped and has been widely reported in jurisdictions all over the place, although the study was based in Ontario. And it was published to the Journal of the, not the Journal of the American Medical Association, not JAMA. It was published to the American Journal of Medicine, which is a top tier medical journal in my world. Well, not my world, but in terms of what I'll call a reputation score, the top tier of the medical journal in the medical journal world, I would put the Lancet at the top. They seem to have the highest profile and the best reputation. And then close to them, I would put the New England Journal of Medicine, the aforementioned JAMA, Journal of the American Medical Association. These are what I consider the top drawer: Lancet, JAMA, New England Journal of Medicine. Then you have kind of a second tier, and I would put this American Medical Journal in that, but in that second tier. But still, it's a highly regarded medical journal, and they publish the results of a study. And the study indicated that maybe that the unjabbed are at greater risk of being in a car accident or in a car crash. I've linked below an article. I'm just going to share this from driving.ca. And the headline is, unvaccinated drivers are more likely to crash. And in today's world, sadly, a lot of people just read the headlines. We live in a Twitter world where if it's not 148 characters or less, people don't have the time, the energy, or the critical thinking skills to dissect it any further. They just want the bottom line, so they just read headlines. And this proclaims very loudly, and it's not the only article doing this, unvaccinated drivers are more likely to crash. And then the subtitle is, researchers suggest, quote, observed risks might also justify changes to driver insurance policies for those without COVID-19 vaccine. And this was published on December 14th, so 4 days ago. And could COVID-19 vaccine, this is the article now I'm reading, this is the first two sentences. Could COVID-19 vaccinations be related to traffic safety? While the dots definitely haven't been connected directly between those two, a new study suggests that people unwilling to get vaccinated may be at more risk of a serious traffic crash. And if you parse that sentence, if you break it down, that second sentence, so the dots have not been connected directly between these two. So they've looked at correlation, not causation. And they say that their study suggests that people unwilling to get vaccinated may be more at risk of a serious car crash, which inherently means they may not be. I may not be, you may not be, we may not be. We might be, we might not be. Our study basically crapped out and we weren't able to determine. I've got 986D saying that car crash one is something else. And this was done in the province of Ontario. You know, G20, G7 country, highly developed, decent education system, everything else. You know, it's not Botswana. It's not a study done in rural Bangladesh or something. This is Ontario, Canada. And what they one serious flaw that I looked, because I scanned through the actual study as published in that medical journal, is that they looked at 11 million over a prescribed time period. I forget the time period, but it's after the vaccinations became available. And their denominator, the total number of people affected, they looked at drivers, passengers, and pedestrians, people seriously hurt in car crashes. Well, it's the wrong denominator. You need to look strictly at people behind the wheel of the car. But what they're suggesting, they're not suggesting that the unvaccinated all of a sudden are having major health issues. What they're suggesting is that the unvaccinated it's a personality analysis. They're saying these are individuals who flout convention, who don't follow the rules, who reject authority. And that, so if they reject authority in this area and are refusing the COVID shots, well, will they reject the authority of our traffic laws and such, and not obey traffic signals and things of that nature? And to my mind, it's propaganda with a capital P, and getting back to trying to gaslight the unvaccinated and to create this perception of what an unvaccinated person is like. Trudeau did this with his, unvaccinated people don't follow science, they're misogynists and they're racist and they hold unacceptable views, and we should not tolerate these people. It was, Goebbels would have been very proud of Trudeau's rhetoric on the COVID vaccines. And the last thing I wanted to cover, it relates back to something I saw in that movie about all the people who have been experiencing sudden deaths. And in that little documentary, there was a US pathologist, and he was talking about something that had occurred to me, and I'd even voiced it on my Facebook. And if you want to follow me, you're welcome. Gordon Causey, Gordon Cawsey, Charlie Alpha Whiskey Sierra Echo Yankee. I'd written about this before, but there's so many things going on in the world. So many, it's like playing whack-a-mole. You're just trying to keep up with everything, the mask, the jabs, the lockdowns, this driver study. There's so much going on. But when the COVID vaccines first came out, the mRNA specifically, so the Moderna and the Pfizer, they talked about incredibly cold storage temperatures. And it just occurred to me that if that cold storage chain was broken, would that affect this mRNA? And I was reading an article in the Jerusalem Post that was quoting a senior doctor at a major hospital, I believe in Tel Aviv, and then a doctor, professor, PhD at a medical school in Israel. And they were describing mRNA, messenger RNA, as being incredibly fragile and that it breaks down incredibly easy. 986 is saying he found me on Reddit where I'm Growacet, Growacet, like a drug. Percocet, Growacet. Anyway, I've linked down below as well. I think it's the third link. This is on the storage requirements. And this is from Ontario's Department of Health, health.gov.on.ca. and then a whole bunch of backslashes on how to store and the Pfizer vaccines, and they divide them into four. There's the purple cap, which are for ages 12 and up, orange cap for ages 5 through 11, gray cap with a gray border for ages 12 and older. This is the bivalent. And then they have a maroon cap for ages 6 months through 4 years. And they give the storage instructions. So for the Pfizer purple cap, and the purple cap again is the one that most people, they say that in Ontario, 90% of those age 12 and up have had their primary two, at least their primary 2 doses. So this purple cap, this is what they said. Storage condition, frozen vials prior to use, kept between -90 Celsius to -60 Celsius. That's -130 degrees Fahrenheit to -76 degrees Fahrenheit until expiry date indicated on the vial label. And then it gives a couple links for information regarding vaccine expiration extensions. Protected from light in the original packaging until ready to use. So I'm going to, non-expert, assume that means that it's not to come into contact with direct sunlight. Protected from light in the original packaging until ready to use. Can store in a freezer between -25 to -15, and that's Celsius, for up to 2 weeks. Vials stored between -25 and -15 for up to 2 weeks may be returned one time to storage condition of between 90 to 60 degrees Celsius. Track the total time vials are stored between -25 and -15. Cumulative total of 2 weeks should not be exceeded. So you have these vials being stored at insanely cold -90 to -60 degrees Celsius. Then they're taken out, and they can be taken out for as long as 2 weeks at between -25 and -15. But if it goes beyond 2 weeks, then I guess you're not allowed to use them. And then it has another category, thawed unpunctured vials. Prior to dilution, thaw and store between +2 and +8 for up to 31 days, or at room temperature for no more than 2 hours. During storage, minimize exposure to room light and avoid exposure to direct sunlight and ultraviolet light. Thawed vials can be handled in room light conditions. Do not refreeze thawed vials. And again, this is all still the purple cap, the ones for people 12 and up. Thawed punctured vials. After dilution, store between +2 and +25 Celsius and use within 6 hours from the time of first puncture. During storage, minimize exposure to room light and avoid exposure to direct sunlight and ultraviolet light. After dilution, can be handled in room light conditions. Dilutant. The dilutant, so I assume this is what is added to the vials that dilutes them, stored between +20 to +25. Outside of this range anything outside this range must be tracked. Excursions between 15 degrees Celsius to 30 are permitted, provided dilutant is stored at a temperature stable environment. Dilutant may be stored between +2 and +20 for up to 5 days. Anyway, the point, I'll leave anyone who's sufficiently intrigued. You can go and read up on that. these are incredibly meticulous, time constrained, avoid direct sunlight, avoid even ambient room light, I guess, in certain conditions, 2-hour time frame once it's been punctured. And the point that was made in this little documentary that I don't think a heck of a lot of, but the U.S. pathologist was saying that it's highly, he considered it possible and perhaps even highly probable that a lot of people, especially if they lined up for a shot in a stadium or a hockey arena, in my town, which is rural southeastern Ontario, farming country, a lot of apple orchards. We have a community center, hockey rink, and the vaccination bus has pulled into the parking lot, and they administer them. They've got folding chairs and a little table. And so the question is, did this mRNA break down in a lot of people? Now, in the video that I'm referencing, and this guy has gone on to do public speaking events, and he said that a lot of people may very well have gotten mush, that they may have gotten lucky. And I think it's very much within the realm of possibility, looking over those handling instructions, about the time constraints, and just knowing very simple human nature. I don't think you need a PhD in psychology to know that certain individuals don't like to waste. Don't like to waste. Well, has that been out 2 hours? Oh, put it back in the fridge. We don't want to waste it. Is that possible? Could that have happened? You have an old nurse who doesn't want to waste these precious vials. I think it's very possible. And again, sitting out in the parking lot at a community center, getting poked in the arm with these mRNA shots, could the mRNA have broken down? And again, non-expert opinion, but this is everything I've read on mRNA, on both the Pfizer and the Moderna. It's a nanolipid particle that's which contains this mRNA, which is a message, which is basically, as I understand it, I've heard it described as a FedEx box being sent to your cells and telling your body at the cellular level what proteins to recruit and how to build the toxic spike protein on the surface of the SARS-CoV-2 virus. So if that instruction booklet breaks down, if it dissolves, this pathologist in the US uses the term mush. They may have just gotten some mush. And that finally brings me back to my final point, and that's with respect to talking about this. In Ontario, in my jurisdiction, you're looking at 80% of the entire population has been jabbed. And that's according to the official numbers. And I believe it because everywhere I go, everyone's got that. I don't hear it as much anymore, but for a while I was hearing, I'm going for my 5th shot. And, fill your boots. 5? What's the definition of insanity? Doing the same thing repeatedly and expecting a different result. You got 2, now you need 3, now you need 4, now you need 5. But leaving that aside, there are a lot of reports coming out lately, and that was the point of this poorly done, poorly researched documentary by this guy, Stu Peters. And I say poorly researched because if you're going to do a documentary of that nature, and you're going to present a bunch of videos, you better fact check those videos and make sure if you're going to call something died suddenly, if you're going to present a bunch of videos, well, make sure that those videos line up with your thesis statement. And there was a basketball player who did a face plant on the court back in 2020 before the jabs were even available, and he's back playing basketball. He did not die. And similar stories with a number of the videos. And that just takes away the valid points any valid points that are presented in the video then get painted with the same brush. And so, oh man, that video, I think, did more harm than good in terms of illuminating things. I think it just muddied the waters. But there are a lot of people, and on my Facebook feed, I share it constantly. I'm constantly sharing stories of sudden deaths and adverse events that have been reported. As a matter of fact, I recently just had someone chimed in on my timeline who, if you don't know Facebook, I share something and then other people can take it and share it to their timelines. And a guy named Andre wrote, Gordon Cosey is my go-to guy for all these SADS, sudden adult death syndrome reports. He painstakingly works so hard at finding news clippings that we would otherwise be totally unaware of. And, I shared one about a TV producer, writer who died suddenly, about a veteran rapper at 54 who just died suddenly in his sleep, about a personality, I think in your side of the pond, in Edinburgh or Glasgow, Paul Kitching died suddenly. I'm having to click around. There's another one here. Illinois State Senator Scott Bennett dies suddenly, just age 45. And it just goes on and on and on. There's so many. This was in the Toronto Star. Hamilton Police Constable at 33 died suddenly. And is it unkind to bring this up? Is it insensitive to bring this up? 80-90% of the population have taken these shots. Is it insensitive to bring up all these? And the potential is there. Someone who's taken it could be definitely scared. Is it warranted to be scared? Is it warranted to be worried? What's the long-term safety profile on mRNA vaccines? I would invite anyone to share that with me. And because of the fact that, referencing back to those cold storage guidelines, not guidelines, these are the rules to say you're supposed to handle these shots, or the mRNA has said it's very fragile and it can break down into nothing, into mush. I think there's at least a strong possibility that has happened with a lot of people, that they did not get the mRNA, that it broke down, that it became mush. And now reporting out of Ontario, and I haven't looked at it recently, but I think we're looking at something in the neighborhood of 50% of those who've gotten the jab have tapped out after 2. They've had 2 and they've said, I'm not doing any more. I'm done. And so I do think there's a benefit to sharing these stories about, Celine Dion, stiff person syndrome, Justin Bieber, Bell's palsy, the commentator, the color commentator for the Atlanta Hawks National Basketball Association team, just all of a sudden sitting there and passing out and going into convulsions live on air, with Dominique Wilkins just rattling on as this guy's going, Dominique, oh my gosh, something's wrong. Yeah, no kidding. And we know that all these people took it. There's a 21-year-old basketball player down in Tennessee, young lady. Just about every school in North America required it if you wanted to attend classes. So many people you talk to, that's the only reason they got the damn thing, is because they had no choice, is the way they look at it. I said, well, I had no choice. I needed it to go to school. I needed it to work. I had to attend, I know a gentleman, his son was getting married down in the United States, and the United States would not allow him entry into their country without proof of the jab. So, I had no choice. I had no choice. I would submit you always do have a choice. It's a question of where your priorities lie. And it's a tough one. It's a tough one. It's one that I had to face. And health, living was a priority for me. Taking a substance that with no long-term safety profile was a non-starter. And I could go down the whole depopulation rabbit hole, and maybe I'll do that next week. So I'm going to end it here. Sorry for rambling on. I worked today again from 9 to 3, and I did nap out after having some dinner. The joys of old age. I mean, you always get hungry, or you always get tired. You get hungry, you eat a big meal, and then you get tired afterward. So I'm going to try and keep these to Saturday nights, but I'm thinking of doing one possibly tomorrow, talking about faith, talking about religion, talking about Jesus Christ, talking about witnessing, talking about sharing the gospel in today's godless world, and an experience I had just over the past week at work, talking about it with some young coworkers who have had no exposure to the Christian faith at all. Probably never read a single page of the Bible. Have been to church maybe once or twice in their life, if that, with no understanding of what's being talked about. So I may do that tomorrow night. God bless. I'm going to just read what 986D has been writing, and God love you, man. I appreciate you chiming in. He said, I think this was in reference to the storage guidelines. It's almost like they're making it up as they go along. And he's saying, I'm 36, wife, kids, and nothing could make me take that thing or anyone in my household. And you're welcome for the vids. And I've got Kelvin saying, thanks, looking forward to tomorrow night. I feel stronger in my faith than I ever have. We're living through unprecedented times. And so tomorrow I'm going to talk about the experience I had. I'm going to church tomorrow, and one of the kids I work with has said that he's going to come. And he's 25 years of age, grown up in a completely different world from this old 65 or 60. I'm aging myself, 56. And Kelvin is saying, I used to not know Christ. Well, we were all there, and helped me through these trying times. The Alpha, the Omega, the beginning, the end. Anyway, I'll leave that for tomorrow night. God bless. Kelvin, 986D. Thanks so much. I really appreciate you chiming in. And I'll come back tomorrow night, God willing, and then again next Saturday between 11 and 12. Try and make these regular. You as well.